Well, if you've ever wanted to try a facial filler, one of the things that may have turned you off was thinking the results would fade too quickly. Maybe you'd need a lot of maintenance. Well, that's not so anymore. Today we are talking about the 5-year filler. Dr. Ann Therese Stubbs of Ann Therese Aesthetic Medicine is here to explain. So hi, Dr. Ann.
Hi, good to be here.
So is that a common concern from your patients? They come in and they say, I don't want to come back every few weeks for this.
Exactly. And while nothing's permanent in the face, and we don't want anything to really be permanent in the face because styles are changing, brow shapes are changing, lip sizes are changing, this is a filler that actually builds your own collagen. So we look at it as it is kind of reflating the face after it deflates with age.
Okay, and that's what happens. It's called Bellafill that we're talking about today. So what exactly is it?
It is basically little tiny particles that are suspended in bovine collagen. And bovine collagen comes from an origin of cows, so we do make sure that people are not allergic to anything cow-related, milk, beef, anything, and so we do a skin test first. But it's bovine collagen with little tiny particles in there that grow your own collagen. For lack of a better term, it just basically stimulates your own cells to build that collagen. So we're seeing a picture here of a lady who just needed more volume in her face as she was aging. She felt like she was kind of drooping, getting hollow in the cheeks, and so we put little bits of the Bellafill in the temples, in the cheek area, in the mid-face, and just a little bit in the chin where the mouth starts to turn downward. And it gave her just an overall refreshed look, and that gets better and better with the next 3 to 5 years.
So what issues can it treat? You mentioned a lot of the facial issues, right?
Exactly, and I think the first picture they just showed was looking at nasolabial folds, or the big deep folds here from the nose down to the mouth. And that's a lot of people's concern because they just feel like everything kind of comes downward. So if someone wants to start just very generally, we will usually start with those folds, but really we get the biggest bang when we do volumize the upper face. A lot of people hollow in their temples, they hollow right in the cheeks, and so you're seeing again the picture I think here of the nasolabial folds, just that fold from the nose down to the mouth, and you can see 5 years out is the one on the right, and it's basically getting better and better. It's not fading at all.
So what is the actual process like? Is it pretty simple?
This is very simple, and actually it seems to be less bruising the way that we do it than the traditional fillers, because we use just one tiny little needle hole, and then through that little needle hole we will introduce what's called a cannula, and it's a blunt edge, and so it's not a needle, and it kind of wiggles through right under the skin, doesn't cause any shearing of any blood vessels, and thus no bruising. So we basically can kind of lay it down in little ribbons, I call it, right underneath the skin, and it's very soft and very malleable, so the patient gets an immediate result from that rich bovine collagen. Now the bovine collagen fades over the next 2 months, and those little particles migrate in and create your own collagen to fill in that space.
So what if somebody out there says, I've been getting other fillers, I don't like the maintenance maybe that comes along with them, I want to try something like this. Are they a candidate still for this?
That is the best candidate for this, because I like to say that, this is a more permanent filler, kind of semi-permanent, 5 years. There's really no eraser for it.
Okay.
So if someone says, hey, I don't like it, I want it gone, there's really no way to get rid of it. So I like people to know that they like that volume in there. So some of the more temporary fillers, the ones that go away with time, if someone has been on those for years, that's an excellent candidate for this, because they know they already like the volume, and this is going to last longer.
And I love these before and afters because, they look 10 years younger.
Exactly. That lady that you just saw, she just had a lot of thinning in her face, and a lot of gals, as they age, we kind of laugh in the office that it does not come off here anymore, it comes off our face. So as the years go, we lose volume from the face, and that's what causes everything to come downward. So it's kind of like a liquid facelift.
All right, Dr. Ann, you always take care of our viewers. What's the offer today?
We basically want everybody to come in for a consultation first to see if this is right for you or not, but we're doing 20% off Bellafill for daytime viewers.
Okay, sounds like a great deal. Dr. Ann, Aesthetic Medicine, thank you so much for being with me.
Thanks for having me.